Can anyone give me an example of a drug interaction? बोलो कोई बोलो. Probenicid and penicillin, additive, supraadditive, antagonistic, warfarin and sulfonamide, synergistic action, antagonism, omeprazole and clopidogrel, succinylcholine and penicillin. Succinylcholine and penicillin के बीच में भी कोई interaction होता होगा जरूर, आप कह रहे हो तो. Cisapride and ketoconazole. Rifampicin causes contraceptive failure, सही बात है बिल्कुल. Clopidogrel and omeprazole फिर से आ गया. Rifampicin and digoxin, warfarin plus aspirin, estrogen and rifampin, quinine and codeine, dabigatran and verapamil, carbidopa and levodopa, aspirin and clopidogrel synergism. ठीक है. Erythromycin and theophylline. Okay, so students are answering there about so many drug interactions. Okay, so you are basically talking about drug interaction here, because you are giving only examples of interaction between two drugs. In this lecture, we'll talk about something else also. Anyways, so what is an interaction? What is an interaction? What is student-teacher interaction? है ना, नॉर्मल क्लासेस होती थी तो स्टूडेंट टीचर्स के बीच में इंटरेक्शन होता था, सिर्फ पढ़ाने के अलावा भी और कुछ बात होती थी. ड्रग फूड इंटरेक्शन, someone is also saying. Okay, people are still giving examples. Okay, so what is an interaction? There is a kind of interaction that takes place between student and teacher, where a teacher comes to the LT. जब नॉर्मल दिन होते थे तो speaks his heart out, है ना, बक 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 करता है और चले जाता है. So that is a kind of student-teacher interaction. Then there occurs a student-student interaction. बच्चे बैठ के बात बनाते हैं कि ये टीचर बिल्कुल अच्छा नहीं पढ़ा के गया, ये टीचर तो अच्छा पढ़ा के गया, है ना. स्टूडेंट ही जज कर रहे हैं टीचर को. हमने भी किया अपने टाइम में, ठीक. फिर स्टूडेंट जाते हैं वहाँ फोटोकॉपी वाले भैया के पास, है ना, वहां से नोट्स फोटोकॉपी कराते हैं. बुक्स होती हैं, बुक्स खरीदने की बजाय उनकी फोटोकॉपी करा के ले आते हैं, एक दूसरे से नोट्स कॉपी करते रहते हैं. तो वहाँ स्टूडेंट फोटोकॉपी वाला भैया इंटरेक्शन होता है. फिर वहां से बाहर निकलते हैं फोटोकॉपी शॉप से, तो मिलाता हुआ एक खूबसूरत सा डॉगी आता है जो आपको देख के मुस्कुराता है. तो वो ह्यूमन एनिमल इंटरेक्शन. आप भी उसको मुस्कुरा देते हो देख के, तो वो भी खुश हो जाता है. तो ह्यूमन एनिमल इंटरेक्शन भी होता है. फिर आप जाके अपनी किताबों के साथ थोड़ा सा प्यार करते हो, है ना, जो आपको करना चाहिए. तो स्टूडेंट एंड बुक इंटरेक्शन भी होता है. फिर उसके बाद लास्ट में स्टूडेंट एग्जाम इंटरेक्शन होता है. ये पूछा जाता है आपसे और आप खूब नकल करते हो, जैसे आपने टर्म एग्जाम में खूब नकल करी, ठीक है. सो व्हाट इज एन ड्रग? सो दीज आर सम काइंड ऑफ इंटरेक्शंस जिसके बारे में हम नॉर्मली बात कर सकते थे. अभी तो दुनिया का बुलेट है. अभी आपका सिर्फ एक स्मार्ट डिवाइस के साथ इंटरेक्शन हो रहा है और हम लोगों की आवाजें बेकार हो चुकी हैं, उसमें से निकलती है. नाउ what is a drug interaction? Drug interaction is an unintended, something which is not intended. Sometimes it may be intended also. Sometimes it may be intended also. It may be intended also. So a drug interaction is an unintended, usually unintended, sometimes intended effect of using two or more drugs. Two or more drugs, in which case it is known as a drug-drug interaction. Sometimes it may be an unintended or intended effect of using a drug with a food, something which we normally consume to obtain energy, to obtain fun. So it may be an effect of using drug and a food, in which case it is known as a drug-food interaction. Sometimes an interaction can occur between drug and a beverage. It is known as drug-beverage interaction. Sometimes a drug, an allopathic medicine, a modern medicine, can interact with a medicinal plant, which is known as a herb, in which case it is known as a drug interaction. There are so many herbs in real world scenario which are being used, है ना. लोग इतनी सारी जड़ी बूटियां खाते हैं, आप उनको बुरा नहीं कह सकते जब तक आपने उनके बारे में नहीं पढ़ा. And you are taking, the patient is taking a medicine, modern medicine also. So a modern medicine and that herb can also interact with each other. A modern medicine, allopathic medicine can interact with a homeopathic remedy. So an allopathic homeopathic medicinal interaction can also occur. So these are some examples of drug interactions. It is an unintended or intended effect of using two or more drugs, drug and a food, drug and a beverage, drug and a medicinal plant. So coming to the definition of drug interaction. So आप लोगों ने जितने examples दिए थे, those were examples of drug interaction. Drug interaction is a modification of effect of one drug by another drug. सिर्फ जो bold में लिखा हुआ है आप उसको पढ़ लें तो आपके लिए अच्छा है. It is the modification of effect of one drug by another drug. We are only talking about the effect that a drug produce on the human body. So it is the modification of the effect of one drug by another drug. और अगर डिटेल में पढ़ना है so it is the modification of the effect of one drug, object drug. The drug whose effect is being modified can be termed as object drug by the prior or concomitant administration of another drug. This drug can be said to be a precipitant drug. ठीक है, तो some people want to use these terminology. What is an object drug? What is a precipitant drug? Precipitant drug याद कर लीजिए. Precipitant drug is the one which brings about the modification of effect of another drug. So drug-drug interaction is the modification of effect of one drug, object drug, by prior or concomitant administration of another drug, which is known as precipitant drug. Why should you study drug interaction? Why should you study anything? Either because of fear of stick, that it may be asked in the exam. You know, stick तो use कर ही नहीं सकते, but exam तो ले सकते हैं फिर भी. Or the hunger of carrot. This will definitely lead to improved patient care. So drug interaction is one aspect. बहुत छोटा सा aspect होता है patient care का, but if you want to remember this, it is good. If you cannot solve a problem, if your patient is presenting with some problem that cannot be explained by any other thing, you can think of drug interaction. So drug interaction may be a small part of patient therapy. So if you know about drug interaction, it will definitely lead to improve patient care. जिसके लिए आप पढ़ाई कर रहे हैं, अपनी मेहनत कर रहे हैं. So what are the clinical outcomes of drug interactions? What are the clinical outcomes of drug interactions? There may be loss of therapeutic effect. You want a desired effect. You want the drug to produce a desired effect, and because of drug interaction, that desired effect, that therapeutic effect is lost. So there may be loss of therapeutic effect. Sometimes because of drug interaction, there may occur toxicity of a drug. Blood levels may increase and it may produce toxicity. Sometimes there may be an unexpected increase in pharmacological activity. Whatever the desired pharmacological activity you want, that activity increases many-fold. There may be beneficial effect. For example, additive and potentiation or antagonism. There may be chemical or physical interactions such as IV incompatibility in fluid or drug mixture. Let's say you come across a patient in casualty who present to you with severe gastritis, and you decide to inject a proton pump inhibitor, let's say pantoprazole, and a 5-HT3 antagonist, let's say ondansetron. If you are giving pantoprazole and ondansetron, and if you are going to inject both of them intravenously, please take them in separate syringes, because both these drugs will have some incompatibility when you take them in a single syringe. It will produce a cloudy, milky solution which may contain insoluble complexes, and it may not produce the desired effect of both PPI pantoprazole and 5-HT3 antagonist ondansetron. You know? So we also talked about some IV incompatibility when we talked about aminoglycosides. So ऐसा सभी कुछ हो सकता है. These are some clinical outcomes of drug interactions: loss of therapeutic effect, toxicity, unexpected increase in biological activity, and sometimes beneficial effects also. All drug interactions may be intended or unintended. ये बोला था आपको. Now, what are the mechanisms? of drug interactions. These are some mechanisms of drug interactions. When people study drug interactions, they like to know about these. Some teachers ask what are the various drug interactions that you know of. So drug interaction could be pharmacokinetic, it could be pharmacodynamic, it could be both. When we talk about pharmacokinetics, we are talking about absorption, distribution, metabolism, elimination, first pass metabolism, plasma protein binding, volume of distribution, half-life of a drug, and so many things. We are talking about pharmacokinetics. When we are talking about pharmacodynamics, we are talking about the mechanism by which the drug is producing the effect. Also, we are trying to quantify that effect. Higher the blood concentration of the drug, higher will be the effect. So, we are talking about drug interactions. So, these are two broad mechanisms of drug interactions. A drug interaction may be pharmacokinetic in nature, it may be pharmacodynamic in nature. Sometimes it may have both the components. Pharmacokinetics, it's very relative. Pharmacokinetics involve the effect of drug on another from the point of view that includes absorption, distribution, metabolism, and elimination. And pharmacodynamics are related to pharmacological activity of the interacting drugs. There may be synergism, antagonism, altered cellular transport, effect on receptor site, etc. We'll see as we go on. अगर इसके बारे में कुछ लिखा गया है तो. Now, talking first about pharmacokinetic interactions. We are going to give you some examples of every kind of interactions. So we are starting with pharmacokinetic interactions. Pharmacokinetic interactions may be due to altered GIT absorption. Altered GIT absorption increase भी हो सकता है, decrease भी हो सकता है. So we are talking about altered GIT absorption, which may occur because of altered pH, altered bacterial flora, or formation of drug chelates or complexes, drug-induced mucosal damage, and altered GI motility. So there may be so many reasons. There may be so many reasons of altered GI absorption of drugs. Altered GI absorption of drugs. So we are going to talk about first altered pH. You know that the non-ionized form of a drug is more lipid soluble and more readily absorbed from the GIT than the ionized form of a drug. So these are examples of some weakly acidic drugs. Barbiturates such as phenobarbital or barbiturates होते हैं. NSAIDs such as aspirin, diclofenac, methotrexate, sulfonamides, penicillins. These are examples of some weakly acidic drugs. And these are some examples of weakly basic drugs: morphine, atropine, amphetamine, quinine, hyoscine. Please, if you can remember, please remember a few examples of weakly acidic drugs. Please remember a few examples of weakly basic drugs. So what will happen when the pH is altered? Now, if you give an antacid to the patient or an H2 blocker or a proton pump inhibitor, what will it cause? It will cause decrease in gastric acidity. It will decrease the gastric HCl levels by whatever mechanism. It will decrease gastric acidity. There will be increase in gastric pH. pH will increase. pH is the negative logarithm to the base of 10 of hydrogen ion concentration in moles. So whenever the gastric acidity decreases, the pH increases. As the pH increases, the absorption of weakly basic drug increases, whereas the absorption of weakly acidic drugs will decrease. I hope इस वाली स्लाइड में आपको कोई confusion नहीं है. So antacids and proton pump inhibitors, H2 blockers also, they decrease gastric acidity, they increase gastric pH, they increase the absorption of weakly basic drugs and decrease the absorption of weakly acidic drugs. Examples आपको पहले बताए थे इससे. Now, we are talking about altered GIT absorption. Altered GIT absorption, pharmacokinetic drug interactions. Altered GIT absorption. We talked about alteration. What will alteration in pH will do? Now we are going to talk about altered intestinal bacterial flora. Altered intestinal bacterial flora in patients who receive digoxin, and 10% patients who receive digoxin, 40% or more of the administered dose is metabolized by intestinal flora. Now, if you give an antimicrobial, if you give an antibacterial, antimicrobial, antibiotic, which kills a large number of normal flora of the intestine. What will happen? This administered dose, 40% of which is getting metabolized by the intestinal flora. This 40% metabolism will decrease. So there may be increase in digoxin level and increase in toxicity. So antimicrobials who are prone to kill the normal flora of the intestine may increase digoxin levels. May increase digoxin levels in patients who are receiving digoxin for whatever indication that you know of. And hence digoxin toxicity can occur. Now, coming to example of complexation or chelation, when drugs forms complexes or chelates. Tetracyclines, as you have been told, interact with iron preparations, they interact with also with the calcium, which is present in milk. So tetracyclines, when given along with iron or milk, they produce unabsorbable complexes. They will not get absorbed when taken orally. So this is one example of a drug interaction. You can also say drug-food interaction if you are talking about milk only. Antacids normally contain aluminium or magnesium hydroxides. They decrease the absorption of ciprofloxacin by 85%, by up to 85%. So you may need to increase ciprofloxacin levels, ciprofloxacin doses. Now, coming to drug-induced mucosal damage. As you know that your gastrointestinal tract is covered by a mucosa lining होती है, and that mucosal lining is rapidly dividing, and the entire mucosal lining is replaced, I think, in 3 days. So when you give an anti-cancer drug, anti-neoplastic drug, it will, apart from affecting the cancerous cells, neoplastic cells, it will also affect any kind of rapidly dividing cell. So because mucosal cells are rapidly dividing, these anti-neoplastic, anti-cancer agents such as cyclophosphamide, vincristine, procarbazine, others may also be there. They will affect the gastrointestinal tract mucosa. They will damage the mucosa and hence will inhibit absorption of several drugs such as digoxin or any other kind of drug. So this is a common occurrence which takes place with anti-cancer drugs. Now, what will happen in case of altered motility? If the motility of the gastrointestinal tract is increased or decreased, what will happen to the orally administered drug? Let's say we are talking about metoclopramide, which is an antiemetic drug. Antiemetic drug होती है metoclopramide, prokinetic भी कह देते हैं इसको लोग. It increases the absorption of cyclosporin due to increase of stomach emptying time. It increases the absorption of cyclosporin due to the increase of stomach emptying time, which may lead to the toxicity of cyclosporin. So it is an example of altered motility affecting the drug levels. Now, we talked about absorption. Now we are going to talk about plasma protein binding. Plasma protein binding. What will happen to plasma protein binding when 2 or more drugs are given? Some drugs, after being absorbed from the site of administration, after passing through the liver for the first time, where it undergoes first pass metabolism, it reaches the systemic circulation where it has a tendency of binding to the plasma proteins. Some drugs bind to plasma protein in a very high concentration as compared to other drugs. So we are going to talk about that plasma protein binding here. It depends on the affinity of drug to plasma proteins. The most likely bound drug is capable to displace other. So 2 or more drugs may bind to the same site of the same plasma protein. The drug with the higher affinity will displace the drug with the lower affinity. That will lead to displacement reactions. And thus the free drug is increased by displacement by another drug with higher affinity. Phenytoin is highly bound to plasma proteins. 90% of the drug is bound to plasma proteins. Tolbutamide is 96% bound. Warfarin is 99% bound. So let's say you are giving a patient is on warfarin therapy. Majority of warfarin, 99% of the warfarin is plasma protein bound. Now, if you give drugs like aspirin, sulfonamides, phenylbutazone, they will displace this previously bound drug from the plasma protein binding site. So if you give an aspirin to a patient who has been taking warfarin, aspirin will displace warfarin from plasma protein binding site. The free concentration of warfarin will increase and it may produce its harmful effects. So you need to either not give aspirin or you need to correct the doses of warfarin. Acute cases में आपको क्या करना है, warfarin toxicity होगी तो आपको उसके बारे में ही मालूम होना चाहिए, how to manage a patient who presents with bleeding tendencies. Is vitamin K useful? Are there any other maneuvers which will be helpful in cases of warfarin toxicity which may occur due to concomitant administration of aspirin, which is displacing warfarin from plasma protein binding site. So this kind of thing can also lead to drug interaction. Moving on, what will happen in cases of altered metabolism? है ना, यही लिखा हुआ होता है सिर्फ किताबों में, altered metabolism. Whenever we talk about drug interactions, majority of the drugs only talk about altered metabolism. We are still talking about pharmacokinetic interactions. Pharmacokinetic interactions in which we talked about absorption, we talked about plasma protein binding, now we are talking about metabolism. So the effect of one drug on the metabolism of other is well documented, and the liver is the major site of drug metabolism, but other organs such as WBC, skin, lung, GIT, sometimes kidneys are also involved. And cytochrome P450 is a major drug metabolizing enzyme. Therefore, the effect of drugs on the rate of metabolism of another can involve the following examples. ये सब कुछ examples होते हैं when we talk about drug interactions. These are some examples of altered metabolism of drug, altered metabolism of one drug by another. Now, we are giving the example of enzyme induction. Enzyme induction always takes some time, whereas enzyme inhibition can take place within days. Enzyme induction will require some weeks at least. So what will happen? A drug may induce the enzyme. It may induce the drug metabolizing enzyme that is responsible for metabolism of another drug or even itself. Example include carbamazepine. Carbamazepine, which is an anti-epileptic drug, anti-seizure medication, increases its own metabolism, which is known as autoinduction. Autoinduction शायद किसी और drug में भी होता, protease inhibitors में भी होता. But carbamazepine, which is an anti-epileptic drug, increases its own metabolism as well as other drug metabolism. So that will lead to decrease in theophylline levels or reduce theophylline action. If the patient has been taking theophylline for, let's say, for COPD, let's say for asthma, let's say for any other indication. So enzyme induction, there will be increase in the levels of drug metabolizing enzymes by carbamazepine. That will lead to increased metabolism of theophylline, which will lead to reduced theophylline action. That will lead to therapeutic failure. Another example includes phenytoin. Phenytoin increases hepatic metabolism of theophylline. So carbamazepine and phenytoin are examples of enzyme inducers. And footnote में लिखा हुआ है, enzyme induction involves protein synthesis. For enzyme induction means production of new enzyme. For enzyme production, you need enzymes are made up of proteins. You need new proteins. For new proteins, you need time. You always need time for production of new proteins. You can inhibit an enzyme simply by blocking the कौन सा साइट होता था एंजाइम पे जिसको ब्लॉक करके एंजाइम ब्लॉक हो जाती थी. Who will tell me biochemistry? Active site. So you can block the active site of the enzyme. You can block an enzyme, but in order to produce new enzyme, you require new proteins, and new protein synthesis will take time. So enzyme induction involves protein synthesis. Therefore, it needs time for up to 3 weeks to reach a maximum effect. So if an effect is being produced by enzyme induction, it will always take some time. Now coming to enzyme inhibition. Enzyme inhibition will lead to increase of the concentration of the target drug and leading to the increase of its toxicity. English में लिखा है. What will happen in case of enzyme inhibition? One drug will inhibit the drug metabolizing enzyme, which is metabolizing the previous drug which is being given to the patient. So enzyme inhibition will lead to increase in the concentration of the target drug. It will lead to increase in the concentration of the target drug, and this increased concentration may result in drug toxicity. Will result in higher concentration of the drug in the plasma, and that higher concentration may produce toxic effects. Note, inhibition of enzyme may be due to competition on its binding site. So the onset of action is short and may be within 24 hours. So enzyme inhibition takes place almost immediately within days, whereas enzyme induction requires some time. Note, when an enzyme inducer such as carbamazepine is administered with an inhibitor, let's say verapamil, the effect of inhibitor will always predominate. So the effect of verapamil will predominate. जरूरी नहीं है आपको याद रहे, बट ये एग्जांपल आपको याद रहे, बट ये जनरल आपको याद रहना चाहिए प्रिंसिपल. When an enzyme inducer and an enzyme inhibitor is given, and if they are affecting the blood levels of each other, then the effect of enzyme inhibitor will predominate initially. Now, these are some drugs related to CYP3A4. CYP450 is a superfamily of enzymes. Cytochrome P450 has so many members, has so many enzymes, subenzymes, and CYP3A4 is a major drug metabolizing enzyme which is responsible for metabolism of majority of the drugs. Other B subforms होते हैं CYP के, है ना? But we are talking about CYP3A4 here. It is a substrate for a large number of drugs. For metabolism of majority of the drugs, CYP3A4 is responsible. So you should remember the example of drugs which are inhibitors of the CYP3A4 as well as inducers of CYP3A4. तो आपको ये वाले examples याद रहने चाहिए. Some examples of inhibitors include protease inhibitors. HIV medications में आप अभी पढ़ेंगे protease inhibitors. Some macrolide antibiotics such as erythromycin and clarithromycin are also inhibitors of CYP3A4. Cimetidine, ciprofloxacin, azole antifungals, isoniazid and valproate. इसमें से at least 3-4 ऊपर वाले तो 5 azole antifungals तक आपको याद रहने चाहिए, है ना? इतना तो आपसे MCQs में ही पूछा जाएगा. So these are some important inhibitors of CYP3A4. Protease inhibitors, macrolide antibiotics such as erythromycin, clarithromycin, cimetidine, ciprofloxacin, and azole antifungals. Some important inducers of CYP3A4 include phenytoin, carbamazepine, rifampicin, phenobarbital, and griseofulvin. You can remember pioglitazone and glucocorticoids. अच्छी बात है, ऊपर वाले 5 आपको याद रखने चाहिए. जब भी ड्रग इंटरेक्शंस की बात करते हैं तब आप सिर्फ इसी पे फंसे हुए होते हो, CYP3A4 inhibitors and inducers पे. So at least ये तो याद रखना ही रखना है. So these are some drugs which are related to CYP3A4. If you give a drug, if you give an enzyme inhibitor will lead to what? What will happen in cases of an enzyme inhibitor? Will there be increase in concentration of the drug? Will there be decrease in concentration of drug? Will there be toxicity of drug, or will there be a therapeutic failure? Who will tell me? Someone is telling me. There is increased toxicity. Okay, so you are on the right track. How opposite will happen in cases of inducers. Inducers will always lead to therapeutic failure. Inhibitors will always lead to toxicity of the drug. कौन सी drug? The prior drug which is being given. These drugs, when given, these inhibitors, CYP3 inhibitors, may be considered as precipitant drugs, which are bringing about the drug interaction. Anyways, moving on. Now, these are some drugs related to CYP182. 1A2, which is an important drug metabolizing enzyme for caffeine, theophylline, phenacetin, clomipramine, clozapine, thioridazine. कैफीन एंड थियोफाइलिन फिनाक्सेटीन तो आपको मालूम होगी कौन सी ड्रग्स है. क्लोमिप्रामिन, क्लोजापिन एंड थायोरेटाजिन नहीं भी मालूम तो कोई बात, बट दीज आर सम drugs which are related to CYP1A2 subtype of cytochrome P450. So inhibitors of this enzyme subtype enzyme include omeprazole, nicotine, cimetidine, ciprofloxacin, and inducers include phenobarbital, fluvoxamine, vilnaflexin, venlafaxine, and ticlopidine. So let's say if you are giving an enzyme inhibitor, CYP1A2 inhibitor like omeprazole in a patient who is taking theophylline. What will happen? Who will tell me? Toxicity will happen. Toxicity can happen. It can occur. Will happen का तो पता नहीं, but ऐसा हो सकता है कुछ. Now, these are some examples. Erythromycin inhibit metabolism of estamazole and terpenadine. Increases the serum concentration of these antihistaminics. Estamazole and terpenadine are antihistaminics, leading to increase in life-threatening cardiotoxicity. Maybe these antihistaminics may produce life-threatening cardiotoxicity at higher levels. Erythromycin, by inhibiting the metabolism of these antihistaminics, may increase the drug concentration of estamazole and terpenadine, and there may be occurrence of life-threatening cardiotoxicity. Other example, omeprazole, it inhibits the oxidative metabolism of diazepam. So diazepam levels can increase. Increased diazepam levels will produce what? You must know. So CYP450 modulation, example of microsomal enzyme inhibition. Erythromycin inhibits metabolism of anticonvulsants like carbamazepine. Patients stable on anticonvulsant therapy may experience toxicity of anticonvulsant drug. So you may be given an example. You may be given a problem in OSPE part of your practical, where a epilepsy patient or any kind of seizure patient is stable on tablet carbamazepine, and the patient develops some kind of infection, and the doctor prescribes erythromycin, and you will come across some toxic effects of carbamazepine. So you have to identify that a drug interaction has taken place because of precipitant drug erythromycin, which has increased the concentration of carbamazepine, and toxic effects of carbamazepine are now occurring in patient. So you may be asked to comment, correct, and rewrite prescription. आपको एक prescription दिया हुआ होगा, then you will have to comment that erythromycin has caused drug interaction with carbamazepine. Erythromycin has increased the carbamazepine levels. Because carbamazepine is being given as an anticonvulsant therapy, which is being running for a long period of time, you will not change carbamazepine, but you will definitely change erythromycin to any other drug which is not known to produce interaction with carbamazepine. So in that way, you can attempt that question. Now, example of microsomal enzyme induction. Patient on antitubercular drug rifampin may experience therapeutic failure with oral contraceptives. So rifampin is a microsomal enzyme inducer. It will increase the concentration of enzymes which are responsible for metabolism of oral contraceptives. Oral contraceptives, which may be containing both estrogen and progesterone, or progesterone only. So when there is increase in enzyme, microsomal enzymes, there will be increased metabolism of oral contraceptives, and oral contraceptive levels will decrease with increased microsomal enzymes. Because of decreased oral contraceptive levels, therapeutic failure of oral contraceptives can occur. Pregnancy can occur in patient who's on oral contraceptive. So rifampin can lead to failure of oral contraceptives. ये आप लोगों ने example भी दिया था अभी. Now, coming to example of enzyme inhibition. Disulfiram, which is used for aversion therapy of alcohol de-addiction, causes inhibition of aldehyde dehydrogenase, and accumulation of aldehyde occurs, which cause unpleasant symptoms. So, alcohol metabolism, alcohol is first metabolized into an aldehyde, which is then converted to acetic acid. Alcohol converts to aldehyde with the help of alcohol dehydrogenase, aldehyde to acetic acid with aldehyde dehydrogenase, and disulfiram causes inhibition of this second step, aldehyde dehydrogenase. So the cycle will, this process will stop, halt at aldehyde level. So there may be increase in aldehyde concentration, and this aldehyde may produce its unpleasant effect. Some drugs like metronidazole, tenidazole, dexamethasone, so many midazoles, other drugs which may not be which may not belong to metronidazole. So these drugs can also cause inhibition of aldehyde dehydrogenase. So these drugs, that is sulfonylureas and metronidazole, cause disulfiram-like reaction. When a patient is taking metronidazole, he should be advised that do not take alcohol. Otherwise, you will experience very unpleasant symptoms. Even if you forget to tell the patient and the patient takes alcohol, next time he will know that he is not supposed to take alcohol whenever he is being prescribed metronidazole by the name of metrogyl or flagyl. Now, another example of enzyme inhibition is methotrexate, which is an antimetabolite. It causes inhibition of dihydrofolate reductase, DHFR. You must know other examples of dihydrofolate reductase inhibitors. कौन बता सकता है मुझको? Who will tell me inhibitors of DHFR? Trying it तो अच्छी बात है. So, in patients, methotrexate causes inhibition of dihydrofolate reductase. If the patient is being prescribed methotrexate for particular kind of cancer, particular kind of neoplasm, or for any other reason, let's say rheumatoid arthritis, you may require folinic acid to be given to the patient. So folinic acid rescue therapy is given, or leucovorin rescue therapy is given to such patient. Coming to example of enzyme induction. Pyridoxine, also known by the name of vitamin B6, acts as a coenzyme for dopa decarboxylase. Peripheral conversion of levodopa to dopamine increases and less is available to cross blood-brain barrier. You give levodopa, in which cases in patients of Parkinson's disease, you want higher amount of levodopa to cross the blood-brain barrier, so that dopamine levels can increase in the basal ganglion. If more conversion of levodopa to dopamine occurs peripherally, if the patient takes pyridoxine, there may be therapeutic failure of levodopa. So whenever the patient is on levodopa or levodopa plus carbidopa therapy, you advise the patient not to take multivitamins without doctor's advice. If you want a multivitamin, you should prescribe multivitamins which do not contain B6, B1, B2, B3, B12, vitamin C, A, E, D. इतने सारे multivitamin दे दोगे, B6 मत दो लेकिन इसको, because pyridoxine or B6 act as a coenzyme for dopa decarboxylase. Peripheral conversion of levodopa to dopamine increases and less is available to cross the blood-brain barrier. So avoid multivitamins containing B6 in patients on levodopa therapy. Also give carbidopa, which is a peripheral dopa decarboxylase inhibitor. This must have been told when you were told about anti-Parkinson's drug therapy of Parkinson's disease. Now coming to examples of drug interactions which will take place at the level of first pass metabolism. Oral administration increases the chances for liver and GI metabolism, leading to loss of part of drug dose, decreasing its action. This is more clear when such drug is an enzyme inducer or inhibitor. If, for example, rifampin lowers the concentration of verapamil, by increasing its first pass metabolism. So these are some very few examples, very rare examples of drug interactions which may occur due to change in first pass metabolism. Rifampin lower the concentration of verapamil. Rifampin, a drug being given for TB patient, drug given for prophylaxis of meningococcal meningitis, drug given for management of leprosy, and lower the serum concentration of this particular calcium channel blocker. Also, rifampin induces the hepatic metabolism of verapamil. है ना? So first pass metabolism भी increase कर रही है, and it is also inducing the hepatic metabolism of verapamil. So by that, rifampin decreases the verapamil levels. Now, coming to some examples of drug interactions which may take place at the level of kidneys at the time of elimination of drug via the kidney, at the level of renal excretion. When we talk about active tubular secretion, you must have read about propanacid. Propanacid decreases the tubular secretion of penicillin, and it also decreases the tubular secretion of methotrexate. So for penicillin, propanacid is co-administered. For methotrexate, it is to be avoided. Please read about this thing. Remember about propanacid that it decreases the tubular secretion of penicillin, and it decreases the tubular secretion of methotrexate. So why it is co-administered with propanacid? Why it is to be avoided in patients who are on methotrexate therapy. Now, coming to passive tubular reabsorption. Passive tubular reabsorption, excretion and reabsorption of drug occurs in the tubules by passive diffusion, which is regulated by concentration and lipid solubility. Whenever you talk about renal elimination, you must remember glomerular filtration, tubular secretion, and tubular reabsorption. ये तीन processes आपको पढ़ाए थे physiology में. Tubular secretion is active, tubular reabsorption is passive. So tubular reabsorption, so drug interaction can take place at the level of tubular reabsorption also. Glomerular filtration शायद कुछ नहीं है, इसलिए आपको सिर्फ tubular secretion and tubular reabsorption. It is known as reabsorption because the thing is being absorbed for the second time. First, it is being absorbed from the stomach. Now it is being absorbed from the kidneys. So ionized drugs are reabsorbed lower than non-ionized ones. This basic principle you know. So if you give soda bicarbonate, it increases the lithium clearance and decreases its reabsorption. If you give a urine alkalizer, it increases salicylate clearance and decreases its reabsorption. Why this will happen? Can anyone tell me why soda bicarbonate or urine alkalizer is increasing salicylate clearance? It's more ionized. So if a drug is getting more ionized, salicylates, I think it is a weakly acidic drug. If you keep it in an alkaline environment, it is more ionized, it is less lipid soluble, so there are less chances of it getting reabsorbed. So now talking about pharmacodynamic interactions. So pharmacodynamic interaction means the alteration of the drug action without change in its serum concentration by pharmacokinetic factors. So when we talk about pharmacodynamic interactions, we are not talking about kinetic interactions. We are not talking about drug concentrations or getting affected. We are talking about something else. So pharmacodynamic interactions means alteration of drug action without change in its serum concentration. So propranolol and verapamil may produce synergistic or additive effect. Propranolol or beta blocker, verapamil calcium channel blocker. Both may be given in a patient of, let's say, hypertension. So you will see additive or synergistic effect. Synergism. What does synergism mean? Synergism means maths की धज्जियां उड़ रही हैं equal to 1 plus 1 equal to 3. तो synergism ऐसा सही कुछ होता है. Synergism means one drug plus one drug will produce an effect greater than 2. It may be 3, 4, 5. So synergism means 1 plus 1 is greater than 2. the effect of combination is greater than the additive action of both the drugs. Addition simply means 1 plus 1 equals 2. Potentiation can sometimes occur. The drug, instead of producing an effect at the receptor level, it may produce effect at somewhere else. Let's say down the it may produce an effect not at the same site but at different site. So potentiation means 1 plus 0 is greater than 1. 1 plus 0 equals to 2 views. Antagonism means 1 plus 1 will be less than 1. So that is an antagonism. ये सब आपको बुक्स में मिलेगा, अपनी बुक से पढ़ने की कोशिश करनी है. Now, effect at the receptor site. These are some common effect antiadrenergic drugs. Antiadrenergic, you know about receptor blockers of alpha receptors, beta receptors. Anticholinergic drugs are also receptor blockers. Now, pharmacodynamic, since we are talking about pharmacodynamic interactions are difficult to classify, and they may occur at the level of receptors, they may occur at the level of signal transduction mechanism. There may be antagonism of physiological systems. At the level of receptors, they may produce effects like homodynamic interactions, which are occurring at the same receptors, or heterodynamic interactions, which are occurring at distinct receptors. So let's say if you are giving beta blocker and calcium channel blockers, and both are producing desired effect for a patient of hypertension, that will be an example of heterodynamic interactions. Homodynamic interactions are occurring at the same receptors. We may talk about pure agonist, partial agonist, or antagonist. Antagonism may be competitive or uncompetitive. So this is difficult to classify. Pharmacodynamic interactions are difficult to classify, and this is a simple classification which you can think of. Now, what are the risk factors? What are the risk factors for what? What are the risk factors for what? किस चीज के बारे में पढ़ रहे हैं हम लोग? Who will tell me? Okay, someone is still listening. We are talking about drug interactions. So what are the risk factors for drug interactions? There are some high risk drugs which are known to produce drug interactions. So these drugs that show a narrow therapeutic index, it is theophylline, corticosteroids, rifampin, oral contraceptive, quinidine, lidocaine. These are some high risk drugs. May not be due to only narrow therapeutic index, maybe other reasons also. These drugs are liable to produce so many drug interactions. So you have to be on the lookout for drug interactions with these high risk drugs. Sometimes there are high risk patients also. These are a group of patients that should be treated with caution due to specific health condition. Pregnant females, malignancy cases, diabetic patients, patients on liver or kidney disorders, asthmatic patients, and cardiac disorders. So in these patients, you can think of more drug interactions. Now, what is the onset of drug interactions? I told you, drug interactions can occur within days, within weeks. When we were talking about inhibition, enzyme inhibition and enzyme induction, microsomal enzyme inhibition and induction. So we are again talking about the onset of drug interaction. Drug interaction may take from seconds up to weeks. For example, in case of enzyme induction, it needs weeks for protein synthesis, while enzyme inhibition occurs rapidly within 24 hours. Sometimes drug interactions take place even before administration of drug to the patient. जरूरी नहीं है patient को दवाई दें उसी के बाद. Drug interaction can take place. For example, mixing of ondansetron and pantoprazole makes a milky complex in the syringe when both need to be given by IV route to a patient of severe gastritis with vomiting. So both, if you want to give both pantoprazole and ondansetron to the patient, both should be given separately in separate syringes. Same cannula से दे सकते हो आप, है ना? Pantoprazole दे दो पहले, उसके बाद normal saline inject कर दो. Just wait for a few seconds, then give ondansetron. But both should be given separately. So you should be on the lookout for drug interactions. You should be on the lookout for traffic when you are crossing a road. You should be on the lookout for drug interactions. When you are treating a patient, small part of your attention can go to drug interactions also. अगर थोड़ी सी बच जाए, अगर आपके पास हिम्मत, दिमाग बच जाए आपका इतनी सारी चीजों के बाद, तो आप ड्रग इंटरेक्शंस के बारे में भी सोच सकते हैं. Monitoring therapy and making adjustments, especially in conditions requiring polypharmacy when you're using more than one drug. So be on the lookout for drug interactions. Monitoring blood levels of some drugs with narrow therapeutic index will save you a lot of time. Monitoring parameters that may help to characterize the early events of interactions. But let's say if you are giving, the patient is on warfarin, you can monitor prothrombin time. Now, there is something known as drug-food interactions, which may occur when you give particular kinds of food to the patient who's on a particular drug. So, ऐसा कोई food होता है, avocado, brassicas family. Brassicas family से belonging some vegetables belonging to Brassicas family, such as Brussels sprouts, broccoli, cabbage, and this fruit by the name of avocado. These are enzyme inducers, and they may affect warfarin. So, a patient on warfarin, अगर आपको याद रह जाए, कोई नहीं पूछने वाला आपसे, but there is something known as drug-food interactions. So, avocado and vegetables belonging to Brassicas family may produce enzymatic induction of warfarin, and warfarin blood levels may be affected. Avoid giving these kind of foods. Grapefruit. Grapefruit is different from grapes. We are not talking about grapes here. Grapefruit is different than grape. Grapefruit contains some chemical. अगर आप ढूंढ सकते हैं तो बताइए, which is an enzyme inhibitor and can cause microsomal enzyme inhibition of drug metabolizing enzymes for calcium channel blockers, cyclosporin, tacrolimus, terphenadine, temizole, carbamazepine, acvinavir, midazolam, alprazolam. So avoid giving grapefruit on patients on these drugs. Something known as drug-herb interaction is also there. So these are some common herbs which are in circulation in the market. Soya. Soya contains estrogen mimicking compounds given to postmenopausal females. Garlic. इतने सारे हम लोग garlic खाते हैं सब्जी में डाल के, मीट्स पे लगा के. Ginseng and ginkgo biloba. ऐसी भी कुछ herbs होती हैं जिनको सलमान खान, शाहरुख खान बेच रहे होते हैं कि आप जवान बने रहेंगे, ginseng and ginkgo biloba खा लो. So these herbs can produce some kind of interactions with other commonly prescribed medicine. If you can come across it and remember some drug interactions, what is the mechanism, what are the drugs affected, अगर आप पढ़ना चाहें तो पढ़ सकते हैं. I was also told to tell you about drug cosmetic interactions, but आप खुद पढ़ें तो अच्छा है. Thank you. Thank you. Now there will be a second class by Dr. Niket. Please take a break of few minutes and come back. Thank you all.